Hi, I'm Dr. Max Lingenfelter, and welcome to our video on what is knee arthritis. In order to understand what arthritis is, we need to first understand cartilage. Cartilage is the protective coating on the mobile ends of bones. In other words, it pads the joints. This protective buffer allows friction-free, pain-free movement. Here's an example of a normal knee x-ray where the healthy cartilage, which is soft and does not show up on x-ray, is protecting these two rough surfaces from each other. And even though the patient is bearing weight, you can clearly see through the joint. There is evident space indicating the presence of cartilage. Here's an example of the appearance of real healthy cartilage. You can see it is simply a covering overlying the end of the bone, where it must provide motion against another bone. When it's healthy, it is actually 100 times slicker than ice on ice. Here's an example of a cross-section of bone indicating this cartilage has grown quite thin, but is still protecting the underlying bone, which is very important because that's where the pain fibers and nerve endings live. Now back to the original question, what is arthritis? Arthritis is the result of cartilage loss, a loss of that protective buffer. How does this occur? This can result from normal wear and tear, traumatic injury, prior ligament repair such as ACL, or from meniscal injury that may have required surgery. Here's an example of that process occurring in the knee, with the yellow healthy cartilage on the right side of the image and the exposed bone on the left. How is arthritis visualized? It can be seen on x-ray, such as these examples. Here's an example of mild, moderate, and severe arthritis. In each subsequent example, you can see the cartilage becoming thinner and the bony surfaces coming closer to each other. Or it can be seen on MRI. Here's an example of a normal appearing joint with even dark signal throughout the healthy bone. And this is an example of arthritis, evident by bone marrow edema or bruising of the bone, which is the white signal here, indicating there is stress and damage to the bone, which occurs after that protective layer is lost, and these two rough surfaces are contacting each other. Why does arthritis hurt? Well, bones are tough and made to support heavy structures like our bodies. Cartilage, on the other hand, is soft, resilient, and bouncy. When the cartilage wears down and these bones touch each other, this results in significant pain. This is because bones are built with many nerve endings which can transmit pain, and cartilage, on the other hand, has no nerve endings, which is why you don't feel anything when joints are working properly. This has been our video on what is knee arthritis. Please like and share with friends and family if you found it helpful, and stay tuned for our next video on how we treat arthritis.